Okay, the cardiac cycle. I've changed a few slides here just to make images bigger so that they're hopefully easier for you to see. So it's not that I've added information, it's the same information, it's just divided up into more slides so that the figures are a bit bigger, just so that you're aware. Okay, so the cardiac cycle is the time frame between cycles, and it can vary really widely depending on your age and your health. On average, heartbeats beat about 75 beats per minute. But if you're a newborn baby, that actually is a lot faster. It's about every quarter of a second that your heart beats. For somebody who's an athlete who is really well trained, let's say an Olympic athlete, their heart might only beat once a second. So instead of 75 beats per minute, it might be 60. We refer to two terms, systole and diastole. Systole literally means to contract, diastole means to dilate or to relax. So when we're talking about systole and diastole, you have to remember that we have two sets of chambers. We've got the two atria at the top and we've got the two ventricles at the bottom. So depending on who you're talking to, it may be that they're talking about ventricular systole or atrial systole, because both of those things actually do have a time frame where they contract. Same with diastole. Diastole is when the chambers are relaxing. So you can have ventricular diastole or you can have atrial diastole depending on which one you're talking about. Now this is the catch. If I want to measure atrial anything, I can't do that indirectly. Literally, I would have to have probes inside of the atria to actually measure that pressure that I'm talking about. So when anybody's referring to diastolic blood pressure or systolic blood pressure, they're actually talking about an indirect measure of the ventricles, not the atria. So if somebody ever gives you those numbers without specifically stating that it's atrial, they're always talking about the ventricles. So the cardiac cycle itself has 5 periods. Period of isovolumetric contraction, period of ejection, period of isovolumetric relaxation, passive ventricular filling, and active ventricular filling. And basically it goes from 1 to 5 to 1 to 5. It's a cycle. It goes in a circle. This is the representation of those 5 periods. Now, this is where I told you that I added, because these look very small on my computer screen, I wanted to blow them up so that you can see what I'm referring to. So, systole. Where's my mouse? Systole. So you know I'm talking about some type of contraction because I said systole. Now, did I give you a clue as to whether I'm talking atrial or ventricular? No. So systole without a reference means I'm talking about the ventricles. And even in the picture you can see the ventricles are contracting. You can see that that's what that little action picture is supposed to be. There's a period of isovolumetric contraction. Iso means the same, volumetric means volume. So isovolumetric, same volume contraction. If you look at all of my valves, the aortic semilunar valve is closed, the pulmonary semilunar valve is closed, and all, or both I should say, my tricuspid and my bicuspid are completely sealed, right? Even though my ventricles are contracting. You can see that in this picture, right? Well, if every single valve is closed, there is no volume moving, because literally I have to escape through a valve of some kind. So in isovolumetric contraction, we're saying that yes, the ventricles are contracting, but every valve is closed, meaning the volume inside of them is not changing. So just to kind of read this, the atria are relaxed and the blood flows into them from the veins. Ventricular contraction causes the ventricular pressure to increase, and it causes the AV valves to close, which is the beginning of ventricular systole. The semilunar valves were closed in the previous diastole and remain closed. So the heart's contracting, but the volume isn't changing because none of the valves are open. Now the period of ejection. Again, if you look down here, the title is systole, and again, systole means to contract. Since I didn't tell you atria or ventricles, always assume it's ventricles. And in this case, I'm not lying. Once the ventricles start to contract with enough force, as you can see here in the picture, that will actually force my semilunar valves, whether the aortic or the pulmonary, to open. So the period of ejection means that I am ejecting blood from the heart into whatever secondary location it needs to go. If I'm from the right, I'm going to the lungs. If I'm from the left, I'm going out to the body. So the semilunar valves open, blood is ejected. So just again to read what it says down here at the bottom. Continued ventricular contraction causes a greater increase in the ventricular pressure, which pushes that blood out of the ventricle, causing the semilunar valves to open. Third period, the period of isovolumetric relaxation. Now remember what I said about how the chambers create suction, like a little baby snot sucker, right? The little aspirator that you use on babies because they don't know how to blow their nose yet. If you look at the title, it's diastole. Remember, dilate, it means to relax, right? But the period is a period of isovolumetric relaxation. Iso means the same, volumetric, same volume. So, in this picture, you can see that the ventricles are starting to relax. Just like the baby snot sucker, it's creating a suction as it opens up, as it starts to relax. That actually causes the semilunar valves to also seal. Now, notice that it's not completely relaxed. That means that there isn't enough suction to open these AV valves or the tricuspid and bicuspid valves yet. So, there is no change in blood volume in any of the chambers. It literally means all of the valves are closed, but my ventricles are relaxing. So, just to read again at the bottom, as the ventricles begin to relax at the beginning of ventricular diastole, the blood flowing back from the aorta and pulmonary trunk toward the relaxing ventricles cause those semilunar valves to close, and you need to note that the AV valves are closed also. My summation, I guess, on the left-hand side. The heart muscle is relaxing, but volume doesn't change because no valves are open. Period of isovolumetric relaxation. Passive ventricular filling. It's when blood flows from the higher pressure inside of the veins and the atria, my two top chambers, into the lower pressured ventricles. So remember that baby snot sucker thing eventually creates enough pressure to pull water, or in the case of a baby, snot into it. Yes? So as these ventricles relax more and more and more, and there's more of a suction created, it actually causes the tricuspid and the bicuspid to open. Well, that suction is actually going to pull the volume of blood that is inside of these atria down. Just like if I were to take that baby snot sucker and put it into a glass and then just let it go, it would suck water out of that glass just because it's moving from the higher pressure in the glass to the lower pressure, the vacuum I'm creating with the little snot sucker. Notice that the title for number 4 in this thing here is diastole, meaning relaxation. And you can see the ventricles are relaxing. Now we call it passive ventricular filling because technically nobody's contracting right now. I'm just creating that vacuum because of the relaxation of that cardiac muscle. So as the ventricular relaxation continues, I'm reading down here, the AV valves open and blood flows from the atria up here down into the relaxing ventricles. Now this is what's kind of interesting. Most of that exchange of blood from the atria to the ventricles happens during this step. Most of the volume movement happens during this step. So when the blood flows from a higher pressure in the veins and the atria to the lower pressure in the relaxed ventricles. Now, the last step before we repeat everything is the active ventricular filling. Okay? So again, diastole. Notice I didn't tell you whose, so there's only one option for that, the ventricles. So the ventricles down here are still relaxing. Okay? So as they keep relaxing and eventually finish their relaxation cycle, it's the atria that actually contract, and whatever remnants are left up here basically get pushed down into the ventricles for us to go back to number 1, where the ventricles start to contract. Now we call it active ventricular filling because we're actually causing a contraction. It's actually contracting to squeeze that blood down. So it results when the atria contract and pump the blood, whatever's left over up here, down into the ventricles. Now just to read this, diastole, relaxing, so we're talking about the ventricles because I didn't give you a frame of reference. Active ventricular filling because we're talking about the atria contracting. The atria contract, increasing the pressure, the atrial pressure, and completing the ventricular filling while the ventricles are relaxed. So if you want to, you can go back from 5 to 1, because like I said, it's a cycle, right? The cardiac cycle. So it just repeats this pattern. This is basically the pattern of blood flow through the heart, but instead of talking about the blood flow, we're talking about what the heart muscle is actually doing.